Welcome to the Startup Funding Espresso. I'm Hall T. Martin, where we talk about how to raise funding and invest in startups and the time it takes to drink an espresso. If you have a question about startup funding or investing, please go to the website, startupfundingespresso.com, and type in your question into the chat bot in the lower right corner to receive an answer. I hope you enjoy this episode. Hello, this is Hall T. Martin with the Startup Funding Espresso, your daily shot of startup funding and investing. The path for a medical device startup is clearly defined. In building a medical device startup or diligencing one, consider this roadmap. Market requirements. Establish the current state of the market, including size, needs, and current solutions. Product requirements. Define the requirements a medical device product must have to be successful with customers. Clinical unit. A prototype that is used to run initial clinical tests. Preclinical validation. Initial test results with the clinical unit. First-in-human tests. Clinical trials with human subjects. Clinical validation, in-human clinical test results, CE mark, regulatory approval to sell a product in Europe, and first European orders, initial sales of the product in Europe, 510(k) clearance, regulatory approval to sell the clinical device in the U.S., and first U.S. orders, initial sales of the product in the U.S., break even, sales equal operating costs, and growth in scale, sales continue to grow. In reviewing a medical device startup, it's important to know the steps ahead and plan your fundraise forward. Thank you for joining us for the Startup Funding Espresso, where we help startups and investors connect for funding. Let's go start listening to today. Hall T. Martin is the director of Investor Connect, which is a 501c3 nonprofit dedicated to the education of investors for early stage funding. All opinions expressed by Hall and podcast guests are solely their own opinions and do not reflect the opinion of Investor Connect. This podcast is for informational purposes only and should not be relied upon as a basis for investment decisions.